Hi, Temple Shalom. I'm Marjory Langer, an emergency physician and member of Temple Shalom. I am chief of an emergency department in Passaic County. I'm responsible for all of the hospital's ER physicians as well as seeing patients in the emergency department. I've been doing this for 15 years. I've served as president of the medical staff of a hospital, chair of the board, and president of the New Jersey chapter of the American College of Emergency Physicians. The current COVID pandemic is unlike anything we've ever seen before. For example, we've never had to worry about running out of supplies or space in the hospital. The infection rate is extremely high, meaning one person who gets the infection can pass it on to several people. We're thinking one person passes it on to about 3 people. And right now we still don't have enough tests to test everybody who would like to have a test, and the rate of return on the test is an entire week, delaying things much. As more people become infected, we expect hospitals to run low on supplies and space, and infections are spreading even faster. Regarding my experience with COVID so far, I've seen some pretty upsetting trends. Symptoms are all over the place. Some people come in with upper respiratory symptoms, cough, runny nose, fever. Other people come in with diarrhea, weakness. Symptoms can be really all over the place, making it a little bit more challenging to diagnose, and the testing takes a long time. I know the news tells you that senior citizens are at increased risk from this, but what I'm seeing at the hospital is young people in their 20s, 30s, 40s are coming in severe respiratory distress, needing to be put on ventilators. The good news is 80% of us who will contract the infection will get better and won't need any medical care at all. But the 20% who get sick will need some pretty intense medical care and tend to get very sick. My expectation over the coming week is that this is going to get much worse, and we're going to run low on space and supplies for all of the people who suddenly need hospital care. You know what to do to avoid this virus. From hand washing to social distancing, be smart. Rather than going to the supermarket to pick up one thing here and there, make a list, get everything you need at once. Wash your hands frequently and really limit the stop and chats. And know when it's time to go to an emergency room, because I'll tell you right now, it's not a place you want to be. If you're feeling really sick, if you're having shortness of breath, chest pain, severe symptoms, you're getting very confused, then it might be time to go. In the meantime, if you want more information on this, go to cdc.gov. Bye, Temple Shalom.